Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? This is the Mindfully Integrative Show, and this is Dr. Damaris Grossman, your Integrative Family DNP. And so today is the Mindful Public Health Chat, and today's discussion is on cervical cancer. And cervical cancer is Awareness Month for the month of January. And what does that mean, and what are things that we should be aware of when we're talking about that? So cervical cancer, let's go of what exactly is it? And it's cancer in the cervix in the female anatomy. It's the front entrance or the area where women go to. There are cervical cells in the female anatomy, and these cells sometimes can become abnormal or may be cause of awareness for actual cancer. So what happens is most women, they go for a Pap Smear. So tests to get them to screen for this are women that are over the age of 21. There are still Pap smears done for women under the age of 21. And the two tests that are usually done is they test for a Pap test, and they also test for human papillomavirus. And human papillomavirus is one to also change the cervical cells and may cause a type of cervical cancer or abnormal cells within that area, and treatment would be needed. Another one is the Pap smear, where they check for precancerous cells within the cervix. And these are then tested. So both are very necessary screenings, and usually start around the age of 21. Sometimes there is a Pap smear done below the age of 20 if there is a history within the family. In addition to that, cervical cancer treatments or options that have been available is an HPV vaccine. Now, I'm not here to debate on whether you should get it or not get it. It's recommended. I'm a public health advocate, so I'm always recommending for people to screen, do the research, and make the right recommendations, because the recommendations have been stated that preteens from the age of 11 to 12 are recommended to have this vaccine, which then will help prevent the chance of getting human papillomavirus, which then can prevent cervical cancer. Because if you have the virus, there's a chance of it then turning into a cervical cancerous cells. So this is why the HPV vaccine had been initially started. Overall, I'm here to guide you into knowing what cervical cancer is, to lower your risk, make sure you screen, and be your best empowering advocate for yourself. And this month, it is that. And if you have not gone for I'm talking to all those women out there, if you haven't gone for your yearly checkup, or I think every 3 years now over the age of 21 for your checkup, we would recommend. In addition, prevention is consideration of the HPV vaccine, because right now, prevention is key. I mean, at this point in time, there's more chances of prevention than we realize, because cervical cancer is just an iceberg, like kind of the tip of the iceberg, because there's numerous amounts of other cancers that come about due to the HPV virus that has been there. So it doesn't mean because you don't have a cervix that you're not going to get some sort of cancers, because there's other cancers. There's oral pharyngeal cancer, there's anal cancer, There's vulvar vagina cancer and penile cancer. So men can get cancers from this HPV virus. But right now, I'm just discussing cervical cancer for women to help screen them so that there's less and less cases of this potentiating, because more and more women still, if they do not get screened, do not prevent themselves, will and can die from complications of cervical cancer. And I'm here to help be part of the prevention, part of the awareness, and getting you in the right direction, because we have the possibility to prevent over 90% of the cancers just by awareness, screening, and vaccinations. So let's be part of the solution and make a difference each and every day. I am going to place all the available resources that I have gotten this information from. And if you have any questions, feel free to reach out to me. I am just an advocate. I'm not here to make your decisions, just to be the best resource as possible and evidence-based and educated. Thanks so much again for touching base and listening to our show or watching us. This again is Damaris Maria Grossman, Mindfully Integrative Show. Have a wonderful day, or whatever time it is for you. Each and every day, make sure you find a mindful way.
Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not the substitute for professional medical advice, diagnose or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcast or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.